Yeah, I think we'll finish it today.
Morning, everybody. How are y'all?
Morning, how are you?
I'm doing okay. It's Wednesday, so we're halfway through the week, so that's a good thing. Um, any questions before we get started and continuing on our abdominal radiology discussion? Nothing? Okay. Well, again, if you have questions anywhere along the way, email's the best. So that drpoteet@vitalrads.com is your best option there. So we left off yesterday in the middle of our abdominal radiology session, and we left off with spleen. So that's where we're going to continue on today. So when you're talking about the spleen, we already talked about on the previous lectures about where the spleen is located. We also mentioned that there is no objective way. There's no measurements to tell if the spleen gets big or little. I also mentioned that a lot of times when the spleen gets big, even though it may get big, it doesn't mean anything unless it's just huge and really rounded. And so it's one of those organs like the colon in your abdomen that kind of has a mind of its own. It can get big, it can get little, and it can even move around inside the abdomen and being located in different places. And a lot of times that doesn't mean anything at all. When the spleen gets too big, what is the doctor word for a big spleen? And we all know that's probably splenomegaly, kind of like hepatomegaly. And there's different things that can cause the spleen to get really big. There can be malignant things and benign things associated with the spleen, period. The malignant things, there's neoplasia that can associate it with the spleen. And those, the most common ones would be hemangiosarcoma or lymphoma. They can also get other types of neoplasias like mast cell disease and other ones, but the most common one are going to be lymphoma and hemangiosarcoma of the spleen. The splenic masses can also be benign. They can be just a big old large blood clot. Sometimes if the animals get kicked or fall down the stairs or something like that, it will fracture the spleen, and the spleen forms a great big blood clot, which can become really big. But over time, it will usually remodel and resorb and go away. There's another benign tumor that can happen in the spleen called a hepatoma, even though it's kind of named for the liver. You can't, and sonographic or radiographically, and even sonographically, you can't tell the difference by looking at it if this thing is going to be benign or malignant. A lot of times, and this is kind of counterintuitive, but a lot of times the splenic mass lesions are going to be really big. And sometimes the bigger the mass lesion is, the more chance it could be benign. That doesn't make sense when you first think about it, but if you think about it a little harder, it kind of does. So some of the malignant mass lesions that are associated with the spleen, you can think about it this way. By the time they got too big, a lot of times those aggressive malignant mass lesions would metastasize or rupture and spill blood all in the abdomen inside the peritoneal space by the time they got that big. So a lot of times only the benign lesions are allowed to get that big because they don't metastasize to distant sites. So not uncommonly, you'll have, let's say, a Labrador that may come in, and that Labrador will have a huge splenic mass the size of a volleyball or even like a basketball. Literally, they can get that big. And sometimes the larger the mass is, the more likely it may be benign. So here's an example, normal looking spleen right down in here. And we said this is kind of the tail of the spleen. The rest of the spleen kind of goes up this way, but you don't see it because there's too much stuff in the way. This spleen here is kind of lying along the ventral abdominal wall, but it still is slender and homogeneous. It's still got sharply marginated, smooth margins. And so just because the spleen's lying along the ventral abdominal wall, that really doesn't mean anything either. Again, the spleen can kind of move around in the abdomen, located in different places, and can move around, and it doesn't usually mean anything. This animal here has a large rounded soft tissue mass in the mid-ventral abdomen. So remember our mass effect concept and those blue diagrams. And so this is a typical location of a splenic mass. So here's a rounded soft tissue mass. This is a little piece of the spleen. So this thing is probably arising from kind of like a pedunculated mass that's hanging off the edge of the spleen. in that location. And again, by looking at that, could I tell you if that is benign or malignant? No, I can just tell you it's a mass in the midventral abdomen, and I don't even know for sure it's possibly associated with the spleen, but more than likely probably is. You would have to do ultrasound to know for sure if it is actually arising from the spleen. Here's the same animal. Here it is on the VD view, kind of causing a mass effect in the mid-abdomen. Here's a little bit of spleen. So this thing's probably in the mid-body of the spleen as the spleen kind of traverses across the other side of the abdomen on that VD view. This one's a little more obvious. So here's the stomach. We can see the stomach has a little gas in it. Here's the liver. Okay. And it's a little hard to tell where the liver ends and the spleen begins. This is probably spleen here with a friend. So it's got a large rounded soft tissue mass associated with that part of the spleen in that area right in there. So in general, if you can trace this area right up in here and it goes cranial to the level of the stomach, this is going to be liver. Okay. So this part of the spleen, for whatever reason, is just overlapping or silhouetting with that edge of the liver, most likely in that case. But the big thing is notice that there is a rounded mass in the midventral abdomen, and it's probably associated with the spleen. This one's pretty obvious. In this case here, we have an extremely large soft tissue mass in the midventral abdomen. And again, I can't tell you 100% if that's located or coming off the spleen, but more than likely it is. And obviously this thing's causing a huge mass effect because it's causing significant dorsal deviation of the colon, and the small bowel is probably pushing the stomach cranially, and it's pushing all these small bowel loops caudally. So this is a good example of a severe mass effect. And again, if you had to bet on this, which organ is probably rising from, spleen would be a really, really good bet. Another one here. So a large kind of ill-defined multilobular mass in the mid-abdomen, probably has got part of it sitting right in here. And if you look close to the peritoneal space adjacent to it, is kind of wispy in appearance. And so that would suggest that this animal also has a moderate amount of fluid in the peritoneal space that likely is arising from whatever mass lesion this is, which most likely is a ruptured splenic mass. Okay, what is it when the spleen becomes too small and things that can cause that appearance? The spleen becoming too small, again, usually it's pretty rare. Number one, hypovolemia or dehydration can cause that. And even when it does, it's usually incidental. There is no doctor word that I know of for a small spleen. I guess microsplenia could be a word, but I'm not sure that really is. But it's pretty rare to even see a small size spleen. And even if you see that, it doesn't really mean much. Okay, gallbladder. Again, the gallbladder in the animal, in the dog and the cat, you don't see. It's silhouettes with the fluid opacity liver that's around the gallbladder. So most of the time, you're not going to see it at all. You do see it with ultrasound. So that's a huge advantage with ultrasound over the gallbladder in that you can see the gallbladder with ultrasound. Most diseases of the gallbladder that happen commonly in small animals like cholecystitis and infection of the gallbladder, and some of the stones in the gallbladder, they're not radiopaque, so they don't show up. A lot of those diseases, you're not going to see anything at all on plain films that tells you there's something wrong in the gallbladder. Every now and then, and relatively rarely, you will see abnormalities of the gallbladder. Sometimes the stones in the gallbladder are radiopaque, and you can actually see them. They look like little pebbles, kind of ill-defined pebbles in the region of where the gallbladder would live. A ruptured gallbladder, radiographically, you do not see the ruptured gallbladder. However, you do see peritoneal fluid because the bile is now spilling out into the peritoneal space. And so all you'll see in animals that may have a ruptured gallbladder is peritoneal fluid and a lack of detail in the peritoneal space on radiographs. You would have to ultrasound them and sample that fluid to know for sure it's arising from the gallbladder, and the gallbladder could be ruptured. Another word is a gallbladder infection, an emphysematous cystitis, and sometimes you'll see gas bubbles that start to form in the region of the gallbladder, which would go along with a bacterial infection, a cystitis, but now it's caused by a gas-producing bacteria. And every now and then you'll see little gas bubbles in the region of the gallbladder. So I showed you this slide before. This is a cat. These are radiopaque sand-like stones in the region of the gallbladder, and these little coliliths are these in the gallbladder, and these little chain of linear areas in the bile ducts of the liver are called choledocaliths. So we kind of went through that already. Okay, moving along now, we're going to talk about the kidneys. What are things that can cause the kidneys to become big, and what's the doctor word for an enlarged kidney? Well, the doctor word for an enlarged kidney is called renomegaly. Would be a big kidney, and sometimes that can happen unilaterally or bilaterally, so both kidneys could be involved. And there's both benign and malignant things that can cause enlargement of the renal silhouettes or enlargement of the kidneys. The most common types of cancers that occur in kidneys of animals, dogs and cats, again, lymphoma is super common, especially in cats. Cats just love to get lymphoma. In fact, you can usually think of it like this, that when, if you're in Vegas at the radiology craps table and you're going to lay a bet on the table, if there is any kind of neoplasia that is caudal to the neck of a cat, you're going to always bet lymphoma. It's a really good bet. You're going to win that bet most of the time. Okay. On the other hand, if it's a cat and there is a neoplasm cranial to the neck, i.e., in the skull region or the head area, squamous cell carcinoma would probably be your best bet. So that's kind of a neoplastic rule, if you will, for the cat. So south of the neck is lymphoma, cranial to the neck is going to be squamous cell carcinoma. So kidneys, the most common neoplasms associated with kidneys, adenocarcinomas, and lymphoma. Benign things that can happen to kidneys are polycystic kidney disease, which they get multiple variously sized and they can become huge cystic areas in the kidneys of cats, in the cortex of the kidneys. Again, like I said previously, most of the time, anytime you see a cyst anywhere, it's almost always benign, but that doesn't mean it doesn't come without complications that it can cause. Sometimes these cysts can get so big, they put pressure on the normal kidney parenchyma around them, and they can end up causing renal failure because of these large cysts that put pressure on the normal kidney. And we know that polycystic kidney disease in cats is super common, especially in the flat-nosed cat breeds like Persians and Himalayans and things like that. Why that is, I don't know, but it's really common polycystic kidney disease in flat-nosed cats. Dogs can get it too, but not as common as in cats. Other things that can cause the kidneys to become too big, perinephric pseudocyst. We'll talk more about that when we talk about ultrasound. A perinephric pseudocyst, again, if you take that word apart, what does perinephric mean? That means around a kidney. And pseudocyst means it's kind of like a cyst, but it's not really a cyst. It's a fake cyst that sits around the kidneys. And I'll show you pictures of that when we get to ultrasound. But needless to say, radiographically, that can cause the kidneys to appear to be way too big. Okay, so here's some examples. So now I have a rounded soft tissue mass in the mid-abdomen, but instead of being ventrally located, now it is dorsally located. And if I look at the VD view, it looks like it's probably to the right of midline, sitting right in this area, some in here. Well, that's exactly where the kidneys live. And again, you remember our blue diagrams and mass effects. So anywhere in this mid-abdomen, you have to put kidney as a possibility, especially if it's in the dorsal aspect of that mid-abdomen. Okay, so if you see something like this, again, you would have to have a laundry list. Here's my reasonable differential list of things that could be causing this probable right-sided kidney mass. And again, it could be benign, it could be malignant. We would probably have to ultrasound that area and the remainder of the abdomen, but look at that area with an ultrasound to see inside that kidney and see what it looks like. Okay, here's another example. So on the lateral view of this cat, it looks like one of the renal silhouettes is huge. The other one is superimposed on it. They summate together. And so this is one pretty normal sized kidney, and this is one huge kidney. Now on the VD view, can you tell which kidney is the big one and which one is the small one? And yes, you can. So obviously here's the normal size left kidney. Okay, and here, somewhere in here is a poorly defined big old right kidney. And so this one is probably the right one. This one's probably the left one. And again, to characterize that abnormal enlarged kidney further, you'd probably have to stick an ultrasound probe on the cat and see what it looks like. Okay, this one here has a mass effect in the area of the kidneys, obviously, but it also has another distinct feature in that if you look at it, it's kind of got this wispy-like appearance throughout that retroperitoneal region, superimposed over the area of the kidneys and kind of caudal to it. And so in this particular case, we see a lot of fluid accumulation in the retroperitoneal space. So that fluid is probably arising from whatever is wrong with this kidney, whether it's obstructive renal disease, it's infected, it's got cancer in it, and now it's leaking fluid into the peritoneal space. Sometimes you'll also see this wispy appearance if they have a ruptured ureter. So animals, every now and then you'll see that they will come in and especially if they've been hit by a car, had trauma, things like that. And it actually bulges or ruptures a ureter, tears a ureter, and now you get urine that's starting to spill in the retroperitoneal space. So again, ultrasound would be your next bet. What about kidneys that are too small? Well, you see this super common in old cats. Again, if you're at the radiology craps table and you're going to lay a bet, you want to win some money. If the question were to what organ in the animal in a cat is going to fail first as the cat gets older, you're going to always bet kidneys. Cats, for whatever reason, they outlive their kidneys. Okay. And if you had to show me a cat that's probably 9 or 10 years of age, that cat's going to probably be in some kind of renal insufficiency, early renal failure, at least as cats get older. So as cat kidneys get older and they get chronic renal disease, they typically both become really small. So they shrink down in size, and a lot of times they become very irregular in shape. And so very commonly on radiographs, you'll see old cats that come in and both of their kidneys are small and slightly misshapen. And again, it's nice because we have this relative measurement that we can use radiographically. And again, in a cat, the length of a cat kidney should be probably 2.5 to 3, maybe 3.5 times the length of L2. Some of these cats that come in with severe chronic renal disease, instead of being 2.5 times the length of L2, it may be 0.5 times the length of L2. So these kidneys can become super small where they're even hard to find. If it's a young animal, renal hypoplasia or renal aplasia, so a congenital screw up of one of the kidneys where the kidney doesn't form right and it's small and it usually has decreased function. And every now and then you'll see an animal that has renal aplasia. Most likely that's only going to happen on one side if the animal is alive, but some animals are born and they only have one kidney. And that usually doesn't mean anything. It's kind of an incidental ooh-ah kind of thing. So here's an example of this is a small misshapen kidney. The other one's sitting right in here. It looks like it's got some focal mineralization in. On the lateral view, that's probably one kidney in there with these punctate areas of mineralization. The other one's kind of poorly defined, but probably sitting right in here. So again, just eyeballing it, if I would measure the length of this kidney times the length of L2, well, there's L1, this is L2. So you can see it's maybe 1.5 times the length of L2. And so that's a small kidney, typical chronic renal, age-related chronic renal disease in a cat. Okay, mineralization, that last one just had some little punctate areas of mineralization in the kidneys. So dystrophic mineralization are little stones that form in the kidneys, and sometimes they'll be in the cortex. They're actually in what's called the renal diverticuli of the kidneys. That is super common to see in these cats that have chronic renal disease. So little punctate areas of mineralization in the kidneys goes along with in a cat with age-related chronic renal disease. Sometimes they'll actually form stones in the pelvic region of the kidneys or in the proximal-most aspect of the ureters. And these will form usually on the medial aspect of the kidneys, just right in the mid portion of the kidneys where the renal cortex or the renal pelvis is. So here's a kidney here. This is an ugly kidney over here, but I can see these little punctate areas of mineralization here in the area of the kidneys. Lateral view, same thing. So small misshapen kidneys with punctate areas of mineralization is typical what you're going to see in old cats as they get older. Okay, moving along, the adrenal glands. Adrenal glands, as you remember, is also another one of those organs that we do not normally see on plain film radiographs. Every now and then, in certain conditions, you may see them on radiographs. You have to remember where the adrenal glands live. We'll talk much more about adrenal glands with ultrasound coming up because you can see them with ultrasound. But remember that in dogs and cats, the adrenal glands are separate and distinct from each kidney. They're totally separate from the kidneys. That's different in people. They're right next to the cranial pole of the kidney in people. But in dogs and cats, they're a separate little organ. Okay. And they typically live just medial and just cranial to each kidney. Okay. So that's usually where the adrenal glands live. The right adrenal gland, it's right next to the caudal vena cava, and it loves the caudal vena cava. It's like spooning with the caudal vena cava. It hugs the caudal vena cava. It almost looks like it's part of the caudal vena cava wall when you see it with ultrasound, which we'll demonstrate coming up. But the right adrenal gland is intimately associated with the caudal vena cava. So, what are things that can cause the adrenal glands to become too big? It's usually typically going to be one of two things. It can either be Cushing's disease, which, remember, the real name for Cushing's disease is hyperadrenal corticism. So it's where these adrenal glands, for whatever reason, make too much adrenal cortical hormone, which causes lots of clinical signs. And if you remember that Cushing's disease, there's basically two categories or types of Cushing's disease, one being much more common than the other. Pituitary dependent Cushing's disease is caused by an influence from the pituitary gland in the brain that stimulates both adrenal glands to make too much hormone. And in that case, both of the adrenal glands typically are too big. Okay. That happens probably 85% of the time of any dog that has Cushing's disease. The much less common type of Cushing's disease is adrenal dependent Cushing's disease. So, with adrenal dependent Cushing's disease, which only happens maybe 15% of the time, one adrenal gland is too big and making too much hormone. Well, the other adrenal gland on the opposite side typically senses that there's already way too much adrenal cortical hormone floating around the blood. And so it tends to atrophy down and may become small. Okay. It's kind of a negative feedback loop. So sometimes you'll see if the adrenal gland can become huge, you might see it causing a mass effect on radiographs. The other thing that can cause adrenal glands to become too big is cancer of the adrenal gland. And so there's two kinds of cancers that are relatively common: an adenocarcinoma, or another one, it's a neuroendocrine tumor called a pheochromocytoma, which you'll learn about when you take oncology. Okay. Now, there's one weird thing to keep in mind, and this is species difference even between dogs and cats. If on a radiograph or on an ultrasound, remember we just talked about, you sometimes you can see those little punctate areas of the kidney, mineralization of the kidneys. If you see a similar thing, but it's associated with an adrenal gland in a dog, so faint mineralization of an adrenal gland in a dog is almost always due to cancer. It's almost always due to an adenocarcinoma of the adrenal gland, which is a nasty tumor for them to get. On the other hand, in a cat, if you see mineralization of one or both of the adrenal glands, typically it's incidental. It doesn't mean a damn thing. Okay. So species differences, that's something that us veterinarians, obviously, we have to keep in mind. There are species differences. They can be substantial differences between different species of animals, as opposed to the human doctors. To this day, well, not to this day anymore because my dad died last year, but forever after I became a veterinarian, my parents would always say, Brian, after all that much school, how come you just didn't become a real doctor? Okay. So I had to live with that forever. So the RDs, as my parents would have said, the real doctors, so they don't have to worry about species differences. They just have a man and a woman. That's it. Okay. We have to treat every other animal there is, which complicates things. Okay. But what I want you to know with this slide, adrenal gland mineralization in dog is a bad thing. That usually means cancer. Adrenal gland mineralization in cat, you don't worry about it. It's incidental. This is a really, really crappy slide. I need to replace it with a better one. But if you look real closely and you turn on your imaginoscope, you can see there's little punctate areas of mineralization here and another group here. Those are adrenal glands. Mineralization, if this is a cat, which it is, you don't worry about it. If it's a dog, it's worrisome. Okay, moving along to the urinary bladder. The urinary bladder, obviously, you do see. It's variable in size. We know where it's located in the caudal ventral portion of the abdomen. And with the urinary bladder, it's extremely variable in size. It depends on when you last peed. Okay. And so if the animal, just peed or hasn't made urine for a while, the bladder is very small. Okay. If it can get huge, it can take up half the volume of the abdomen if the animal has to pee really bad or is obstructed. There is no way radiographically, unless you do contrast procedures, which we'll talk about coming up, there's no way to evaluate the bladder wall because the urinary bladder wall is fluid opacity radiographically, which silhouettes the fluid in the bladder. And so there's no way to differentiate fluid in the bladder versus fluid of the bladder wall. So there's no way to evaluate bladder wall thickening on plain films. Okay. All right. So what are some abnormalities that can happen associated with the urinary bladder? These are usually pretty easy, and a combination of radiographs and ultrasound will diagnose the great majority of these. So obviously, probably one of the more common abnormalities you're going to see radiographically, especially associated with the urinary bladder, is they get stones in the bladder. So they get cystic calculi, right? Well, some of those stones you can easily see with radiographs. Some of them you don't see, and we're going to review that here in a minute. Another condition is cystitis. Cystitis is an infection of the bladder wall itself. Well, typically radiographically, the typical cystitis, you won't see a damn thing wrong. The bladder looks perfectly normal. In reality, the bladder wall becomes thickened and kind of roughened in appearance. But again, the bladder wall silhouettes with the fluid in the bladder. You can't tell the margins between the two. And so radiographically, you won't see that. Okay. Obstruction of the urinary bladder. Most of the time, the obstruction is caused by something that's stuck in the urethra, much more common in male animals than it is in female due to that extent of the urethra. It's much longer in males than it is in females. But sometimes it can be caused by other things inside the bladder itself, like a mass, okay, or severe chronic infection of the bladder wall causing an obstruction. We'll talk about that. All these, again, we will review a lot more with ultrasound. Okay, neoplasia, the most common mass that can happen in the bladder, as we talked to previously, is a transitional cell carcinoma. That's that tumor that tends to live in the trigonal region of the bladder. So we'll talk about that. Okay, as far as different types of calculi, we know there's lots of different types of calculi. Whenever you should get in the habit when you get out, instead of, you should be a good veterinarian and a complete veterinarian that practices good quality medicine. And so anytime you take stones out of the bladder surgically, you should always send them out for stone analysis. You want to know exactly what is the makeup of those stones. So then you can better treat the animal going forward to try to prevent them from recurring. Okay, because there's different diets, different medications you can put them on to prevent or help prevent recurrence of those stones, but all of that is dependent on what type of stone it is. So you always want to send the stones out. You don't want to just make a necklace out of them or throw them away. Okay. So there's certain stones that happen in the urinary bladder of animals that typically are radiopaque. And again, just as a reminder, radiopaque means you can see them on x-rays. The opposite of radiopaque is radiolucent. Radiolucent means you can't see them on x-rays. Okay, so this is pretty easy. The radiopaque stones typically are oxalate type stones because there are a lot of mineral content, so you see them on radiographs. The radiolucent stones, typically the ones that are always radiolucent, are urates, and the other name for urate stones is ammonium biurate. Okay, and cysteine type stones. Now, the easy way to remember this is look at the word radiolucent, and the lucent part of the word has a U and a C, which conveniently is these first letters of these two stones. Okay, so you can remember radiolucent, urates, and cysteines are typically radiolucent stones. Okay, oxalate stones are radiopaque, and then these other ones, xanthine stones and struvite stones, they can fall either way. Okay, they're plus or minus. Okay, so here I have a lateral view of the abdomen. This is a busy film. Okay, so if I look at it, here's the urinary bladder sitting right in here. It's got a moderate amount of fluid in it, but I've got these little radiopacities in the middle of the bladder. This is highly suggestive that this dog's got stones in the bladder, right? Unfortunately, though, and this would be my luck, unfortunately, look at this colon. Here's a large amount of feces in the colon. And, this is why it would be my luck. This colon, for whatever reason, is taking a roller coaster ride. Like I told you, the colon cannot move around, can kind of do what he wants. Well, this time it's taking a curly Q roller coaster ride. So here comes the colon with a bunch of feces and it's coming down this way and it's going up this way and goes down here. Okay. So part of that colon is superimposed right on top of the bladder. So I can't definitively tell you with a huge amount of confidence if those stones, are they in the bladder or are they in the colon? If they're in the colon, they're going to pass on their own and it doesn't matter. If they're in the bladder, it matters. Okay. So we need to be able to help differentiate. How do we know what's a veterinarian to do? How are we going to decide, are these in the bladder or are they in the colon? Okay. Ultrasound is a really good way to do that. And we'll talk about that coming up. Okay. Sometimes it's a little hard to tell. So here's another dog that has a big dilated urinary bladder. And again, there's this weird kind of suspicious looking thing in the middle of the bladder here. But in this case, I got a bunch of small bowel loops that are overlapping the bladder. So I can't tell you 100% for sure that that stone's in the bladder, or maybe it's in a small bowel loop that's sitting on top of or underneath the bladder. I don't know for sure. Okay. So a couple of things, if you don't have ultrasound or your ultrasound machine is broken, there's a couple of tricks that you can do. One of them is called a negative contrast cystogram. This is a special procedure where you actually would insert a catheter into the urethra and you suck out the urine from the bladder and you fill the bladder up with room air. Okay. And you fill it up to where it's moderately distended. And that might help you to decide if this thing is in the middle of the bladder or not. Well, unfortunately, we still have a bunch of little small bowel loops, but it's starting to become a little more convincing that's probably in the urinary bladder, but I don't know that 100% for sure. Back in the old days before ultrasound, and if you still don't have ultrasound, this typically works pretty well, is you can do what's called compression radiography. So you can get some device, and this device, anybody know what this is? You can see it sitting in here. And if you were to guess, this is a long-handled wooden kitchen spoon. Okay. You can use the edge of a clipboard, like a cardboard clipboard or a plexiglass clipboard, and it will do the same thing. And basically, you put it in here in the area on the outside of the animal where the bladder would live, and you compress the abdomen. So you squish it. Okay. And by squishing it or compressing the abdomen with this device, it would tend to push any there, if there's any small bowel loops or colon that's sitting on top of the bladder, it tends to push them away from the bladder. Okay. And now you can see just the bladder with all these bowel loops in the colon that's not superimposed on top of the bladder. Okay. This veterinarian here made an attempt to use his long-handled wooden kitchen spoon to do compression radiography, but he missed. Okay. The spoon's located cranial to the bladder. It needs to repeat it and put this a little further caudal. Again, that's that same stone. It's starting to look very obvious that it's probably in the bladder. I have to caution you with this. In male dogs, sometimes this can happen to where you're doing a VD view and you see this radiopacity. It's kind of lives back here where the bladder does. Okay. And then what is rule number one with radiology is to do what? Well, most of the time that's going to be always get two views at 90 degrees. So get the other orthogonal view. So it looks like it might be a stone in the bladder here, but let's look at the lateral view. Do I see it on the lateral view? Well, the bladder looks kind of very small. It doesn't have much fluid in it, but I sure as heck don't see a stone in it. Okay. And so what this is on the VD view, if you look here, here's the os penis. This is the prepuce, and this is a dangly os penis or dangly prepuce. And so if I take the VD view, this dangly tip end of the prepuce is going to be end on, and it just so happened it's superimposed over. That's an end on dangly prepuce that is superimposed over where the bladder lives. Okay. And that should tell you that, you need to get a lateral view. You don't want to cut the dog by just looking at this VD view and think, he's got a stone in his bladder. Well, no, he really doesn't. Okay. So always be careful and wary of a dangly prepuce. Good thing. Okay. Cystitis. Again, most dogs that have a bladder infection or cystitis, radiographically, they're going to look damn normal. You're not going to see anything. The only time you'll see anything with cystitis, if it's a gas-producing bacteria, and in those particular cases, you'll see gas within the region of the urinary bladder. So here's our bladder here, and I got all these little gas opacities that are in the bladder lumen, probably stuck to the bladder wall, maybe even migrating into the bladder wall itself. So it's not normal to see gas opacities in the urinary bladder. And so this animal most likely is going to have an emphysematous cystitis. Okay. Most of the dogs, probably 90% of dogs and cats that you'll see with an emphysematous cystitis, most of them will also be diabetic. Okay, and that's because they have glucosuria from their diabetes. They're actually spilling glucose into the urinary bladder. So now we have warm, fluid inside the bladder and urine mixed with glucose, and that makes a great environment for bacteria to grow. Okay, and in some of these dogs, they'll have gas producing bacteria that's causing the cystitis, and that's what you see. So if you see gas in the urinary bladder, you can a lot of times just bet for sure they're going to have diabetes. Okay, obstruction of the urinary bladder. Again, obstruction can be caused by a mass in the urinary bladder that the urine can't get out of the bladder and flow into the urethra. It can be something that's lodged in the urethra itself, so a stone, a urethral stricture, anything that can keep urine from flowing out of the urethra. Okay, a lot of times all you're going to see radiographically in this case is just a great big, greatly enlarged, distended urinary bladder. Radiographically, most of the time you're not going to see a mass in the bladder lumen. You have to use ultrasound to do that. And sometimes you'll see a stone that's in the urethra, but again, not all stones are radiopaque. Sometimes they're not radiopaque, they're radiolucent and you don't see them. So the key here is that you want to do is anytime that you see, here's a dog that's got a kind of a moderately distended urinary bladder. He's got these mineralized opacities. And again, he's got colon in the middle of it. So you could use an ultrasound probe to tell if those are really in the bladder or do compression radiography, which may move that colon out of the way and to tell. But the main thing is this is a male dog. Here's the os penis. Okay, so in male dogs and male cats typically are much more prone to get obstructive disease due to stones lodged in the urethra than females, just to the larger extent and length of the urethra. Okay, so perhaps maybe some of these stones that are most likely in the bladder, they can pass down. And remember, the urethra in a male dog goes all the way down here through the pelvic outlet, spins around, comes all the way down here, and goes out the os penis. Okay, so anytime you have a male dog with urinary issues, you always want to make sure that you always include the entire extent of the pelvic urethra in the film. You don't want to cut the film off right here. You want to always make sure and include that. So here's some stones that most likely are in the urinary bladder. And when you go down caudally, it looks like there's probably some little radiopacities here that are suspicious for stones. And then a lot of times looks like there's 2 or 3 of them right here, right next to the base of the os penis. Okay, so these are obstructing urine flow, leading to an obstruction. So these probably started out in the urinary bladder, and now they were small enough and they exited the urinary bladder and they go down the urethra trying to get out, but they get stuck. Okay. So here's another example. This is just flexing the dog's pelvis so you can see it a little bit better. So yep, there's some stones right up in here as that urethra spins around the caudal aspect of the pelvis. There's some stones. There's probably a few more right in here. And here's those ones right at the base of the os penis. Okay. So bottom line, if it's a male dog with urinary issues on lateral projection, always get a butt shot. Okay, bladder ruptures, again, ultrasound is going to be your best bet here. Typically, all you're going to see with a bladder rupture is peritoneal fluid. So you see a lack of surface serosal detail in the abdomen because now we've got a lot of fluid in the peritoneal space. And in this, with a ruptured urinary bladder, that's going to be urine. We'll talk more about bladder ruptures when we talk about ultrasound. Bladder neoplasia, most of the time the radiographs are going to be normal. Most of the common bladder tumors, this is by far the most common one, a transitional cell carcinoma. This is typically soft tissue opaque. Sometimes it'll have very faint areas of punctate mineralization in that tumor itself, but most of the time it's not enough mineralization to even see on radiographs. And so most of the time, these transitional cell carcinomas that live in the urinary bladder, they also silhouette with the fluid in the bladder and the bladder wall, and you don't see them on radiographs. Ultrasound your best bet to see them. Here's an example. This is inside the urinary bladder on ultrasound, so this is a taste of what's coming up, probably starting tomorrow or maybe even next week. But here's a large mass inside the caudal aspect of the urinary bladder. This is a transitional cell carcinoma inside the urinary bladder. And you can imagine, this is the apex of the bladder up in here. The urethra comes out down here. And if this thing gets big, fluid is going to have a hard time getting out of the bladder into the urethra, leading to obstruction. Okay, prostates. In a intact male dog, the prostate really relatively early on, by the dog is even 9 months of age, the prostate can start to become big due to the testosterone influence and benign prostatic hypertrophy, or BPH. People will just abbreviate it as that. If the dog was castrated early on as a puppy, then a lot of times the prostate never does get big and stays very small. And then even radiographically and even sonographically, in some of those dogs, it's hard to even find the prostate. It's so small, which is typically a good thing. Okay. Remember, the prostate lives just caudal to the neck of the urinary bladder and completely envelops around the urethra. So if the prostate starts to get bigger and bigger and bigger, most of the time it goes bigger, bigger to the outside, but it also tends to go bigger and bigger towards the inside, and it can cause a stricture or a narrowing of the urethral lumen as it passes through the prostate, which leads to the dog's inability or difficulty in urinating. Okay. So benign prostatic hypertrophy, super common problem. And it can cause the prostate to become super big and super huge, leading to difficulty in urinating. And again, as you probably know, the doctor word for difficulty in urinating is stranguria. Okay, like straining to urinate, but stranguria is the word for difficulty in urinating. Okay, an infection of the prostate is called prostatitis. Not that uncommon, especially in older intact male dogs. Most of the time, that's going to be caused by staph or strep. Prostatic neoplasia, adenocarcinoma, is the most common tumor that can happen in older animals, older males. Okay. And for whatever, and we'll talk more about this, we talk about ultrasound also, but for whatever reason, prostatic adenocarcinomas are more common in dogs that have been castrated. Okay. So prostatic adenocarcinomas are more common in castrated dogs than they are in intact male dogs, which is kind of weird, but that's usually the way it is. And then you can get other things inside the prostate too. You can get these cystic areas inside the prostate. These are called paraprostatic cysts. We'll talk about it in ultrasound. And these are cysts that are actually arising from inside the prostate, but then they pop out and they extend around the prostate and can become huge. And again, can lead to difficulty in urinating. And also they can cause such a mass effect, then they can compress the colon as well and cause difficulty in defecating. Okay. What's the doctor word for difficulty in defecating? Anybody remember that? Dyschezia. Does that sound familiar? Dyschezia means having a difficult time defecating. Okay, so here's a radiograph. Here's a urinary bladder. It's moderately distended with fluid. This is the colon above it. But right here is a big prostate. Okay, and that's mild to moderately enlarged. So the urethra, this is a male dog. He's got an os penis. He's got a big prostate. Okay, so the urethramine would come through here, go right through the middle of the prostate, through the pelvis, spin right around and come all the way down here. So great big caudal extent of this pelvic portion of the urethra, but it goes right through the middle of the prostate. Okay. So here's another dog. He's obviously got a huge liver with rounded margins. So this is like most likely like a Cushingoid dog. So he's got Cushing's disease. But again, here's our urinary bladder. It's almost always going to be cranial to the prostate. And here's a moderately enlarged prostate. Okay, so kind of a big prostate, prostatomegaly in that particular case. Okay, in this particular case, here's our urinary bladder, and here's a big prostate sitting in here. But this animal has little focal areas of mineralization in the prostate. Okay, and again, if you see mineralization in a prostate, it's kind of like mineralization of an adrenal gland. Most of the time, probably 90% of the time, prostatic mineralization is going to mean cancer. That usually means prostatic adenocarcinoma. So you don't like to see mineralization inside of a prostate. Okay, again, mild prostatomegaly. And again, you can imagine that if this prostate becomes really, really big, it can cause a mass effect and it can cause dorsal deviation of the colon, which lives right above it. And if it gets so big, it can actually compress the colon, leading to dyschezia or difficulty in defecating. Okay, if I go back to, let's see, this slide here. Okay, so here's a big prostate. You can see it's kind of compressing the colon. The colon cranial too is not that distended, so it's, the animal's probably still defecating some, but it could be having more difficulty in straining to defecate. And if I look in this region here, there's kind of this irregularly shaped opacity ventral to L6 and L7. And if you remember, we said there's a couple of groups of lymph nodes that live right underneath the sublumbar area. And these are called the sublumbar nodes. Okay. So sometimes if you have a prostatic infection or prostatic cancer, it can spread to those nodes. Okay. And if those nodes become really, really big and they cause a mass effect, they too can cause ventral deviation and compression of the colon, leading to difficulty in defecating or dyschezia. Okay, that leads us right into abdominal lymph nodes. So why don't we, this is probably a good spot. Let's take a break. We'll come back at 11 o'clock your time and we will talk about abdominal lymph nodes and where they live. Okay.
Question?
Yeah, go for it.
If a dog or if any animal's in lateral recumbency and the marker like on the film says R, does that mean their right side is to the table or up towards the X-ray beam?
No, the R, and that means they're right lateral recumbent. So that means they're lying on their right side. Right side is down next to the tabletop. If it has an L, then their left lateral recumbent. Their left side is down near the tabletop. And that's a really good question. And we're going to talk a lot about that in just a little bit. In the next section, we talk about stomachs. And believe it or not, this thing called a stomach bubble. Okay. Because now we're going to flip the dog around and right lateral sometimes and left lateral sometimes and see what effect that does. Okay. Most animals, most clinics, when they shoot routine abdominal films, most of them are going to shoot a right lateral view and a VD view. Okay. It's probably not a bad thing to just shoot all three views. So both right lateral, a left lateral, and a VD view. And that's true with thorax as well. Okay. Did that answer your question?
Yeah, perfect. Thanks.
Awesome. Perfect. Okay. Take a break. We'll see you in 10, 15 minutes, whatever it is. Thank you.